Hi everyone, welcome back. So today I am going to do a video which is very closely linked with the video I posted yesterday about tightness and pain in the quadratus lumborum muscle, which sits on the posterior abdominal wall. So today I am going to be following on from that and talking about pelvic tilt, what causes it, how you know if you've got it, what problems it can cause, and what you can do about it. There are three types of pelvic tilt which I will go into, but it's often quite a complex issue. And it's also one of the first things that I kind of try to look for in a client when they come to me, particularly for sports massage. It involves both the spine and the hips, and can quite often it can occur alongside other spinal or hip deformities, things like spina bifida, where in these cases, it can actually cause any existing scoliosis to actually progress further. So, but there are, many more, problems that it can cause. So, but first of all, I'm going to sort of explain sort of in terms of the muscular system, which again is quite complex around that pelvic area. So I'm just going to explain firstly sort of how that sort of affects the pelvis. Okay, so there are various muscles that will control pelvic tilt, and depending on what type of pelvic tilt a client has, that will tell me which muscles are potentially tight or weakened. So pelvic tilt is an imbalance basically in the orientation of the pelvis, so how the pelvis sits in relation to various muscles that you can see in this diagram, in the legs and back. So for example, we're looking at things like the hip extensors, which includes the hamstrings at the back of the thigh and the gluteal muscles in the buttocks. Also the hip flexors. So we're looking at the quads at the front of the thigh, particularly the rectus femoris, because that is the one quad muscle that actually crosses the hip as well as the knee, and therefore acts as a hip flexor. Also the tensor fascia latae, and the iliopsoas. But also the abdominal muscles such as the rectus abdominis, external obliques, and the low back extensors can also will be involved. Now these muscles will place a slight strain on the pelvis even when not in use. There's always a little bit of tension there. But there should be a balance between the pressure and the force from each side, meaning that the back and the pelvis stay aligned and are stabilized. But as I'm going to go on to talk about, if for example these hip flexors, so say if you've got a tight rectus femoris, that's going to pull down on the front of the pelvic bone, and potentially the back extensors may become tight as well, which will pull up at the back, and that's going to give you an anterior pelvic tilt and really accentuate that lumbar curve, putting extra strain. And the longer it stays like this, the more these back extensors will contract, and tighten and shorten, meaning that you're then going to get back pain and all sorts of other, overcompensation of other muscles, etc. And likewise, if the hip extensors, so say if you've got tight hamstrings, that will pull down the pelvic bone at the back. And then potentially the abdominal muscles may tighten, and the pelvic bone, you'll end up with a posterior tilt. But I will go in and, talk about that in a bit more detail. So one way that we can sort of assess a little bit whether someone has pelvic tilt is if we drew an imaginary line across the top of that pelvic bone. That line should be parallel with the floor. The pelvic girdle links the thighs basically to the base of the spine, and it's therefore really important for stability, movement, and maintaining good posture. And when imbalances occur in the surrounding muscles, the pelvis can tilt forwards, backwards, or to the side. And the following abnormalities can then be seen. So firstly, you're going to see some sort of abnormal alignment of that sacroiliac joint, and I will be doing another video about sacroiliac pain that looks at this joint in more detail. The sacroiliac joint is basically on either side of the back of the pelvic bone. It's basically where that triangular sacral bone of the spine meets the pelvic bone. So you will get abnormal alignment there. You'll also see abnormal alignment of the lumbar spine, which may cause early spinal degeneration, and more commonly that I see low back pain. You may see, depending on what type of pelvic tilt, there may be an exaggerated lumbar curve, which you would see in anterior pelvic tilt, or it may be kind of more flattened out, which you would see in a posterior tilt. Now, if we look in terms of sort of people who are doing a lot of athletic activity, we use the hips to generate power when doing these activities. So things like sprinting, jumping, or doing deadlifts in the gym. So any potential condition that may deform the pelvis, such as pelvic tilt, will most certainly affect, physical ability when doing these activities. So I'm going to go on now to just take you through each type of pelvic tilt in turn and explain sort of what's going on with the muscles in each type. Okay, so the first type of pelvic tilt that I'm going to talk about is anterior pelvic tilt. So this is where the pelvis slightly points downwards at the front, with the back rising upwards. And this happens because this rectus femoris, which is one of the quad muscles at the front of the thigh, that for whatever reason becomes tight. And also if the erector spinae muscles, which run alongside the spine, if they are tight, or they could actually become tight, as a result of anterior pelvic tilt. So you then end up with these quad muscles at the front of the thigh which will pull the front of the pelvis down because they attach at the front there. And the back muscles become tight, which pull the pelvic bone up at the back. And that's what causes the pelvic bone to tilt. And in the process, what can also happen, if it's not already been a problem in the beginning, is that if these spinal muscles are tight and shortened, and they stay that way for a prolonged period, then what also happens is you end up with weak abdominal muscles, which just kind of makes the problem worse. And so what happens when you get this muscle imbalance causing an anterior tilt, the result is that you get various sort of anatomical signs. The pelvis obviously is tilting forwards, so it's that way, which creates a strong pull on the psoas muscle, which is one of your hip flexors, so that's pulling that down. But the most obvious thing is that because of this tilt, you end up with protruding buttocks and an exaggerated lumbar curve. And that exaggerated lumbar curve is really going to promote lower back pain. And alongside these two things, you're also going to get a protruding stomach, where that curve has been accentuated, and also where the abdominal muscles are weakened. So in addition to these obvious signs that someone has anterior pelvic tilt, you may also notice maybe a slight decrease in height, and that's just where obviously you have that kind of tilt, and then the body kind of becomes a bit bunched up at the front and kind of brings you down a little bit, changing your postural alignment. You may also notice that the upper body becomes a little bit rounded, maybe causing the head to jut forward, or a bit of a stoop in the shoulders. And this is really just the body of compensating and trying to balance itself out. So as we've said, an anterior pelvic tilt is usually caused by an imbalance in the legs, the hips, the buttocks, the back and the stomach muscles, in terms of flexibility, strength, length of the muscles. Generally it's due, as we've said, to tight quads, psoas and erector spinae on the back, and there may be weakened abdominal muscles. Possibly even the hamstrings you may find sort of become weak, again just where those quads are pulling it down. That means if they're pulling the pelvis down at the front, it's been pulled up at the back, it's going to pull on those hamstrings, lengthen them, stretch them out, and then they become weak again if it remains there for a long time. What causes this imbalance? A lot of the time it's sort of prolonged periods of sitting, whether that's just your lifestyle or that's maybe you've got a driving job, and if your sitting posture isn't great, then that's going to start to cause weakness in certain areas, particularly the glutes, and it will also shorten the psoas muscle, which is one of your hip flexors at the front there. Imbalance may also be caused by working out in, some sort of abnormal posture, and if you're doing that regularly or for a long period, again, it's going to have the same effect. You're going to have some muscles that are sort of probably contracting too much, and others that are being pulled and lengthened that will eventually become weak. Now, as I've said, if this isn't addressed, it's just going to worsen, and also can lead to formation of trigger points in the muscles, which are going to cause more pain, particularly, around the back. So yeah, other signs of anterior pelvic tilt are lower back pain, also hip pain, and that's due to the rotation of the femurs or the thigh bones, which again I will go on to talk about, sort of rotational and pronation, those sort of effects within, pelvic tilt. So yeah, hip pain, also knee pain, and again this is due to rotation of those thigh bones, which can result in a sort of a knock-kneed position. And if you look at my video on knee valgus, which is basically knock knees, that will also talk about the effect of pelvic tilt and rotation of the femur. And also flat feet, which, we know, I talk about it quite a lot. It can have a big knock-on effect on various parts of the body. And certainly people with flat feet are more prone to pelvic tilt. And that's again because of the effect it has on pronation, and also shoulder pain, as we've mentioned, anterior pelvic tilt, it can cause sort of a stooped shoulders as the body's way of kind of compensating, for the sort of postural changes and to allow the body to balance itself out. So yeah, you may also find that shoulder pain may become an issue, and also headaches and neck pain, because we know as soon as those shoulder muscles start getting tight, it has a knock-on effect into the neck, and any tightness around those areas can cause headaches. So, okay, so that's anterior tilt. Now I'm going to go on and talk about posterior pelvic tilt. Okay, so with posterior pelvic tilt, this is where basically the back of the pelvis lowers and the front of the pelvis gets pulled up. And so in this case, it's kind of the opposite of anterior. So in this case, it's those rectus abdominis, those abdominal muscles that become tight, and so pull the front of the pelvis up. And it's the hamstrings that also become tight, and so they pull the back of the pelvis down. And quite often that may result in a weakness in the quad muscles and also in the erector spinae muscles, because where the pelvis is getting pulled up at the front and down at the back, that's causing sometimes these muscles to be stretched out and lengthen, and again, if it's for a prolonged period, that's going to cause weakness in those muscles, which makes the muscle imbalance even worse. So, yeah, we end up here, as we've said, with shortening of those extensors, and also that includes the gluteus maximus, becomes tight as well, which also helps in pulling that pelvis down at the back. And also, as well as the tight abdominal, you'll also find that, you know, in addition to weakness in the quads, you'll also find weakness in the iliopsoas, the hip flexors at the front. They'll also become weak. And so you can see here that as a result, the pelvis is tilting back and down at the back. And this has the effect, there's a strong pull, upward pull on that psoas muscle. And also you're going to end up with more of a flattened lumbar curve, because as the pelvis shifts round, it's going to pull this down. And so that arch will flatten out. Now, posterior pelvic tilt is not as common as anterior tilt, but it does happen, and it's often caused by a sort of a slouching sitting position, which can distort the spine and result in posterior tilt. Usually we find that gym goers who maybe focus too much on their hamstrings, glutes and abs, so we're talking if you're sort of repeatedly doing exercises like straight leg deadlifts or leg press, you know, these sort of exercises may cause the hamstrings and the glutes to tighten more than the quads and the psoas. So this is why I always say it's really important, you know, to sort of do a balance of exercises in the gym. You know, even if you're trying to work more one area, still work, you know, the opposing area, you know, so that you don't end up with these muscle imbalances. As we've said, posterior pelvic tilt can cause sort of loss of that curve in the lumbar part of the spine. It may also again cause the cervical and thoracic segments of the spine to be pushed forward, which causes, you know, a sort of a stooped over appearance. And again, this is really the body's way of just balancing, you know, itself out. The thing to be aware of with posterior tilt is that it may cause a disc herniation, and this is because of the increased pressure on the discs, which can also irritate the nerves, and you may find then that you start to sort of see things like sciatica, you know, becoming an issue as well. So, okay, so that's the first two. Now we're going to talk about lateral pelvic tilt. Okay, so with lateral pelvic tilt, we see a tilting of the hip to the right or the left of the pelvis, and it's usually associated with maybe different leg lengths or scoliosis, but it can also be caused by one leg bending while the other remains straight in standing positions. And so many of us sort of stand with our weight shifted to one side, you know, maybe, you know, mums who kind of balance a child on one hip. You know, this may also become an issue. And so what happens here is the muscles involved will sort of tilt, become imbalanced, and cause a lot of back pain. And so if we look at the type of muscles that are involved, we're looking at things, so for example, the quadratus lumborum, which again, take a look at the post that I just put up in yesterday. You know, you've got one on each side. And so, for example, if the QL muscle on this side tightens, it's going to narrow that space between the top of the pelvis and the ribs, which is then going to mean that you get a sort of uneven, that line across the top of the pelvis will become uneven. And it will cause hip hike, which we're going to talk about. But also the gluteus medius and the adductor muscles on the inner thigh, which, if these muscles tighten, they're going to cause a pull again on the pelvis. Also, the tensor fasciae latae on the outer hip there will also have an effect. So I will go on to talk about exactly how those muscles will affect a lateral tilt. So those with lateral pelvic tilt will also be prone to developing things like disc degeneration, sacroiliac joint pain, which again I'm going to do a video on, muscle spasms, and also disc herniation. As we've said, as part of lateral tilt, one thing that occurs, and this is quite often due to tightness in those QL muscles, is that hip hiking will occur. And this is also due to tight hip flexors, so things like the psoas, but also the hip adductors, which are those ones on the inner thigh, and as we've said, the QL muscle. And so these muscles will require some stretching through massage, and basically to sort of stretch out that lower back area and the flexors, and then the hip abductors, quite often will need strengthening. So there we're talking about things like, the glutes. Okay, so we mentioned there about hip hike. So what we tend to find is anywhere where you've got hip hike, so this imaginary line across the top of the pelvic bone is no longer parallel to the floor, you'll also see quite often a waist crease. And so that's a classic sign of, a pelvic tilt laterally, and probably also going to see an imbalance in the shoulders. Now, if we've got a dropped hip, that is usually going to be caused by weakened hip flexors on that side. So it could be a weakened psoas, it could be, weakened glutes, around the outer hip, or a weakened QL, which obviously then becomes lengthened, and hence the hip drops down. Whereas on this side, where you've got the hip hike, there's going to be tightness in that QL, and in these, in the hip flexors, the psoas at the front, and also possibly around these glutes on the outer hip. Okay, so just in case I've completely confused you, just to be clear, hip hiking, where it comes up, that's going to occur due to tight hip flexors, so we're talking about the psoas, and also tight adductors on the inner thigh, and a tight QL on that side. And so these muscles will require stretching out and relaxing, whereas a dropped hip is caused by weakened hip flexors, so the psoas, some of the glutes, and also the QL on that side will be weakened, and so this requires strengthening of those adductors and the hip flexors. Now, so one thing that we've not really talked a huge amount about yet is the causes of pelvic tilt. Now, I mentioned a little bit earlier about sort of, these sort of anatomical discrepancies, so things like flat feet or leg length discrepancy, which can contribute to pelvic tilt. So basically, in anyone who has flat feet, we know there's a tendency for overpronation of the foot, so they turn inwards. That causes the shin bone to internally rotate, which can also then cause the knee to move inwards, which gives that knock-kneed appearance, or knee valgus. And we find when that happens and when that lower leg internally rotates, also the thigh bone or femur will internally rotate at the hip, and the pelvis is more likely to tilt forwards. So you're going to get anterior tilt. But also, we know even if you haven't got flat feet, if you get an anterior pelvic tilt, that will also cause internal rotation at the hip and potentially of the shin bone. So, excessive pronation, usually due to flat feet. Other causes can be, as we've said, working a sedentary job. So if you've got prolonged periods of sitting, and certainly if you've got an abnormal posture as well, that's going to contribute to pelvic tilt. And that also means, just if your posture isn't, great, just sort of in terms of working out, if you're working out a lot, and really pushing yourself, then that again is going to have a knock-on effect. And of course, these muscle imbalances, that we've been talking about, with sort of tightness, in any of those muscle groups. But also there are some forms of exercise that will result in an uneven impact and pressure on certain parts of the body, which again can contribute to sort of tightness developing in certain muscle groups. So what are the symptoms of pelvic tilt? Well, pain is an obvious one, and certainly the lower back is sort of the common area to have pain. But also, this may bring about, difficult mobilization, possibly hip pain as well. And generally, you're going to see that there's a misalignment, of the lumbar spine, and you may also see degeneration of the sacroiliac joint in the pelvis, which again is going to be, really quite painful. There are some complications also of pelvic tilt. So if you don't address this problem, as I say, the situation's going to get worse. But if left untreated, pelvic tilt can cause worsening, muscle pain, back pain, shoulder pain, which again can sort of move into the neck and then cause headaches. Joint and knee pain, which often arises from that internal rotation of the shin bone and the hip, which again just causes the impact to hit the joints in a different way than usual. So in terms of correcting pelvic tilt, mild cases can be treated by just correcting your posture. Maybe if you've got a sedentary job, you can use one of those posture chairs, which kind of puts you almost in a kneeling position, and it kind of tilts, you forward. Increasing physical activity and just keeping the muscles in good shape, maintaining flexibility. And but if you've got a more severe case, you may need input from a sports therapist such as myself, or a physiotherapist, who can basically address the situation through exercises, but also massage is really valuable, in those with pelvic tilt. So in terms of things that you can do, the easiest thing is walking. This is the simplest way to correct pelvic tilt. It will strengthen the abdominal muscles and the hamstrings and the glutes, and it can also stretch those quads and the hip flexors. As we've said, posture, correcting your posture when you're sitting or standing, with chest up, shoulders back, keeping your back straight and feet shoulder width apart. Just be careful, and I talk about this in the video on the QL muscles. A lot of people make the mistake of, when they think, oh, I must improve my posture, and then they kind of overdo it, and they almost end up overarching that lumbar area of the back further, and if you do this is just going to cause more problems. So now, as we've said, massage is one of the best ways to correct, pelvic tilt. And I'm talking here sort of sports massage. The benefits, obviously, it improves blood circulation, which can be restricted, if there's muscle tightness and pelvic tilt. So, just by improving the blood circulation, massage can help just, relax those muscles a little bit. So by relaxing the muscles, massage can treat the symptoms caused by pelvic tilt, so things like chronic back pain, and it can also obviously address, sort of overcompensating muscles, so maybe up in the shoulders and things. And we saw in the diagram, where I was explaining about hip drop and hip hike, there can also be a drop, or hike in the shoulders as well. So this can be corrected through massage. Obviously, correcting the muscle imbalances, it's not just a case of relaxing tight muscles, for example, in anterior pelvic tilt, yes, we would be looking to relax those quad muscles and the psoas muscles, which contribute to the anterior pelvic tilt, but we'll also be looking at trying to strengthen the muscles that are sort of weakened, so sort of the abdominal and hamstrings, and that can also be done through exercise as well. So you can have the massage to sort of focus more on relaxing the tight muscles, and then use the exercises to really strengthen the weak areas, and in this way you'll really be able to address that imbalance quite effectively. So in terms of exercises, there are exercises that are, can be specifically used for correcting pelvic tilt, but these should really be devised by a sports therapist or a physiotherapist who will actually assess the extent of your pelvic tilt, and who will be able to tell you exactly which muscles need strengthening. So the exercises can certainly stretch and relax tight muscles, but also to strengthen the weak muscles. So it will improve the balance between the opposing muscle groups. So for example, in anterior pelvic tilt, it will look to relax and release the tightness in the quads while strengthening those weak hamstrings on the back. The tension in the pelvis will then consequently become balanced, and pelvic tilt will be reduced. So I'm going to now take you through some exercises for each type of pelvic tilt. These are just sort of basic ones that you can do at home, but as I say, it probably is important to see someone like me who can assess how bad the pelvic tilt is, and just let you know exactly which muscles need to be worked on. Okay, so starting off with exercises that you can do for anterior pelvic tilt. The first one is a half kneeling hip flexor stretch. So basically here you're going to step forward with the left leg. This is assuming that you have tight hip flexor on the right side. So you're going to step forward with the left leg and lunge until that right knee is resting on the ground. And so the left leg should make a 90-degree angle at your knee. And then you're going to bring the pelvis forward by tightening your glutes around here and tightening your abdominal muscles. And you're going to lean forward from the right leg until you feel tension in the hip flexor here, and also in the inner thigh of your right leg. And then you're going to hold that stretch for 30 seconds, release, and then repeat 5 times. Okay, so the next one is bridging, which is great for strengthening the hamstrings and the glutes. And here you're just going to lie on your back with legs bent and feet flat on the floor, hip width apart and arms by your sides. Then you're going to push the heels into the floor as you lift your pelvis up off the floor until your upper body and thighs form a straight line. You're going to hold for 2 seconds, lower down slowly and repeat 8 times, ensuring that you tighten the glutes and the abdomen while in this position in order to maintain a correct bridge alignment. Okay, so the next one is going to be a kneeling leg lift and back stretch, and here this is going to help basically tighten the abdominal muscles and stretch out the back and the glutes. So you're going to kneel on your hands and knees, placing your hands on the floor, shoulder width apart, and align your hips with your knees. Ensure your back is parallel to the ground, so your pelvis is in a neutral position. Pull your belly button in towards your spine and arch your back as you exhale. Hold for 2 seconds, then bring your spine back to the neutral position. Then you're going to extend one leg back and lift it until it reaches the same height as your body, so that your lifted leg and body are in alignment, keeping that spine in a neutral position. And you can hold for up to 5 seconds, lower the leg and repeat 10 times. And then obviously do it on the other side. Okay, so the next exercise is good old squats, which help strengthen the glutes, hamstrings and quads, among a few others. So you're going to place your feet shoulder width apart, toes pointing forward, and you're going to lower to a sitting position until the thighs are parallel to the floor, making sure that you're keeping your abs tight and your back in a neutral position. And then you're going to push up to a standing position and move your pelvis slightly forward by tightening the glutes. And you're going to repeat this 15 times. Now, the things to be cautious about: you don't want to let your knees go over the toes or rotate inwards, because that will actually then worsen the internal rotation that you already have probably in the lower leg and thigh bone due to the pelvic tilt. You want to keep the back in a neutral position. Do not flatten the curve of the lower back or overly arch your back. You must squeeze the abdominals and the glutes and look straight ahead. So when you squat, you've got to keep that spine in alignment and not end up rounding the base of the spine, which is what we call butt wink. Okay, so this way is not good. Okay, so the last one for anterior pelvic tilt is a pelvic tilt exercise. So this will help to strengthen those abdominal muscles and stretch the lower back. And you're going to lie on your back on the floor in a neutral position with your legs bent and toes facing forwards. You're going to pull your belly button in towards the spine, pushing your pelvis up towards the ceiling at the same time. And that will allow you to tilt. You're also going to tighten the glutes and the hip muscles as you tilt the pelvis forwards. And you're going to hold for 5 seconds and do maybe 5 sets of 20. Okay, so those are 5 basic exercises that you can do for anterior pelvic tilt. I'm now going to talk about some basic exercises for posterior pelvic tilt. Okay, so the first exercise for posterior tilt are leg lunges. and these will help to build up your glutes, quads and hamstrings, helping to correct a posterior tilt by preventing any one muscle from dominating. So you're going to stand with your feet together and step your right leg out in front of you, bending the right leg at a 90-degree angle, and your other knee should touch the floor with your right leg still at a 90-degree angle. And if you need sort of help to check your position, you can always, use a mirror. And then you're going to push off your right foot to return to the starting position. And then you're going to step forward with your left leg and form a 90-degree angle to touch your right knee to the floor. And you're going to repeat maybe 3 sets of 10 to 15. And just ensure that you don't bend your knees past the toes, because that can place too much strain on the knees. And if you have knee problems, you may just want to work on the other exercises instead. So the next exercise is a static hamstring stretch. Now we know sitting or standing for long periods can cause tight hamstrings, which may lead to bad posture. So for this one, you're going to sit in a hard chair without a cushion and stretch one leg out in front of you. And you're going to bend down and reach for your toes until you feel a slight stretch. You're going to feel the stretch along the back in those hamstrings. Hold for 10 to 30 seconds and then switch to the other leg and repeat on the other side. Now, if you go down too far into this stretch, you can pull your back. So do be careful of that. And if a chair is too difficult for you, you can also move this exercise to the floor. So the next exercise is Superman stretches, which I'm sure probably a lot of you are familiar with. And these can help you to strengthen the lower back and glutes. So you basically just lie on the floor on your stomach and stretch your arms out in front of you. And then you're going to lift your chest off the floor and try to hold that position, also lifting your feet off the floor. Try to hold that position for 30 seconds and then lower. And repeat for 3 sets with a 10 seconds break, in between each set. Now, if you have a bad back, it's probably best to skip this exercise, because this will really, strengthen and work those muscles around there. Okay, and the last exercise for posterior pelvic tilt are leg raises. So these will really help to strengthen your core and improve your posture. So you're going to lie flat on the floor with your legs straight, and you're going to slowly raise your legs as high as you can without allowing your lower back to arch off the floor. And then you'll slowly lower them back down, keeping your arms flat right next to your body throughout. And try not to move any part of your body except for your legs. So when you do this exercise, it should be these abdominal muscles that are doing all of the work. And so this is really good for strengthening, those weak abdominal muscles. Okay, so those are the 4 exercises for posterior pelvic tilt, and then finally I'm now going to take you through 5 exercises that you can use for lateral pelvic tilt. And it might also again be worth looking at the video on QL, tightness and pain, because there are also some exercises specifically for the QL. So obviously that works in conjunction with lateral pelvic tilt. So do take a look at those ones too. Okay, so the first exercise for lateral pelvic tilt are these reverse leg raises. So these will help to strengthen the glutes and improve hip mobility. Now, the hip that sits lower will probably have weaker muscles, which can make this exercise quite challenging at first. But obviously, that can be the side that you want to, really focus on a little bit more. So you're going to lie on your stomach with your legs resting on the ground and forehead resting on your hands. You're then going to lift one leg while keeping, the knees straight and glutes tightened. Now, do not allow the other hip to come up off the floor. Hold for 2 to 5 seconds and then lower your leg. And you probably want to repeat maybe 10 times and then switch legs. It's important to remember not to arch your back as you lift your leg. You want to squeeze the abdominal muscles to prevent, arching too much. So the next exercise are reverse standing leg raises. So these will help to strengthen the glutes and improve your balance. You may want to hold on to a wall or the back of a chair for some balance. So basically you're going to hold your body straight, tighten those abdominal muscles and lift one leg off the ground behind you. Lift the leg straight behind you as high as you comfortably can without arching the back. And then you're going to lower the leg until your toe is resting on the floor. Repeat 10 times and then switch legs. Now it's important to remember not to swing the leg because that can cause back pain. Now, once you're feeling a bit more confident with this exercise, you can add in a resistance band just to make those glutes work a little bit harder. Okay, so the next exercise for lateral tilt is the hip alignment exercise, which helps you to bring your hips in line with each other. You're going to lie on your back with your feet against a wall and using the leg on the same side as the hip that is tilted towards your shoulder. Press your leg into the wall and at the same time press your higher hip down with your hand. Hold for 10 seconds and then release. And you're going to repeat this 10 times. Okay, so then we have the clamshells, which will help to improve hip mobility and strengthen the glutes. You're going to lie down on your side with both legs bent at a 90-degree angle and with your bottom arm supporting your head. Before you start, roll the top hip slightly forwards towards the ground, making sure that your spine is relaxed and stable. Then you're going to lift the top knee up, but keep those feet together. Hold for 5 seconds and then lower the knee back down. You can repeat this 10 times and then switch sides. Just be careful not to rotate your spine as this can cause additional tension and back pain. And if you want to stretch further, then you can bring your legs closer to your body. Okay, and then the last one is the adductor stretch, which helps you strengthen those adductor muscles on the inner thigh. And you're going to lie on one side with both legs stretched out, using your bottom arm to support your head. Cross the top leg over the bottom leg, placing the foot of the top leg on the floor. And it'll be probably just in front of your knee of the bottom leg. Then, holding your bottom leg straight, you're going to lift it up as far as you comfortably can. Hold for 5 seconds and then lower your leg. Repeat 10 times. Switch sides. And be careful that you don't twist the hips while lifting that lower leg. Okay, so that is really all the basic exercises. As I say, if you see a sports therapist or physiotherapist, once they've been able to assess you, they'll, probably be able to give you some other suggestions as well, things that you can do. But for the purpose of this video, that's really it on pelvic tilt. As I say, do take a look, if you haven't already, at the video I posted yesterday on tightness and pain in the QL muscles, because that is very much related to pelvic tilt. Yeah, for now, that's really it from me. I will have more sports therapy related videos coming up, so do keep an eye out for those. You can subscribe to my channel and you'll be notified when they come out. But otherwise, you can comment down below or contact me through my Facebook or Instagram page with any questions that you may have, and I will do my best to answer you as soon as possible. But for now, that is really it from me. So take care, and I will see you next time.